Hello, and welcome to the Center for Emergency Medicine's training videos. Today, we will be seeing what a trauma assessment should look like according to the NREMT's guidelines. This will adequately prepare you for your National Registry Psychomotor exam at the end of your class.
Medic 1, you're dispatched to Forbes Bar for a man assaulted.
Okay, I'm going to consider my BSI and PPE. I do have proper PPE on at this time. Is my scene safe?
Police have secured the scene.
Okay, my mechanism of injury is assaulted at a bar. I believe I only have one patient at this time. I'm also going to call for ALS backup in case I need it. And I'm going to consider C-spine due to the mechanism of injury being traumatic at this time.
Your partner sends manual C-spine stabilization.
Okay, coming up on scene, what's my general impression?
20-ish male lying supine on the floor of the bar.
Okay, I'm going to assess for level of consciousness. Hello, sir, can you hear me?
He does not respond.
Okay, I'm going to sternal rub my patient.
He begins to groan and move.
Okay, my patient is alert to pain. I'm also going to assess if he has apparent life threats at this time.
None present.
Okay, I'm going to begin assessing my patient's airway. Does he have a patent airway? Are there any obstructions?
It's open and patent.
Okay, at this time I don't believe I need an adjunct then. I'm also going to assess my patient's breathing. Is he breathing and does it appear to be adequate?
Adequate rate, rhythm, and quality.
Okay. Due to that, I don't believe I need to initiate oxygen therapy at this time, and I'm going to manage any injuries that might be impacting my patient's breathing or airway. I'm also going to assess a radial and carotid pulse on my patient.
Both are weak and present.
Okay, what does my patient's skin feel like?
Warm, pale, and diaphoretic.
Okay, I'm also going to assess for any gross bleeding on my patient with a gross blood sweep. Do I find anything?
No blood is found.
Okay, due to my findings so far, I'm going to initiate shock management and keep my patient supine and warm as best as possible using blankets and turning up the heat in the ambulance. I'm also going to initiate high flow oxygen using a non-rebreather at 15 liters per minute.
Your partner assists you in initiating shock therapy.
Okay, due to my findings so far, I believe this is a priority patient, so I'm going to move him to the ambulance where I can continue my secondary assessment while en route to the hospital. Now that we're back in the ambulance and have the patient exposed, I'm going to have one of my partners hold manual C-spine while I continue my assessment and have my other partner attempt to obtain a sample history and baseline set of vitals for me.
Your partner obtains the vitals as follows. A blood pressure of 106/72, a pulse of 114 beats per minute, and 99% on 15 liters.
Okay, I'm going to start my rapid trauma assessment at the head, checking for any decap BTLS on the skull and facial bones, as well as the back of the head.
No deformities felt.
Okay, I'm going to check the eyes to see if they are pearl with my pen light.
Pupils are pearl.
Okay, I'm going to check the patient's nose, mouth, and ears for any blood or CSF leakage.
No fluids present.
Okay, I'm going to check for battle signs behind the ear, as well as raccoon eyes.
None present.
Okay, I'm going to check for tracheal deviation to see if it's midline, any JVD, and any step off on the back of the neck.
Trachea is midline, no JVD, and no step off to the C-spine.
Okay, I'm going to feel the top of my patient's shoulders here, as well as his clavicle and down his sternum.
Stable.
Okay, due to that, I'm going to have my partner place a C-collar as I continue my assessment. I'm also going to feel my patient's chest wall for any abnormalities or paradoxical movement.
No paradoxical movement, no abnormalities.
Okay, I'm going to listen to my patient's breath sounds, high and wet on both sides.
Lung sounds are clear and equal bilaterally.
Okay, I'm going to continue moving down my patient's abdomen, feeling for any abnormalities or any tenderness or rigidity in the patient's abdomen.
Abdomen is rigid and distended throughout.
Noted. I'm going to make note of the patient's genitalia and examine it if I thought it was necessary. I don't at this time. I'm also going to assess their pelvis for stability.
Pelvis is stable.
Okay. I'm going to start on the patient's left leg, searching for any injuries, as well as PMS. Do I feel a pulse?
Pulse is present.
Can you feel which toe I'm touching? Can you move your foot?
No movement.
Okay. We're going to start on the patient's right leg. Do I find a pulse?
Pulse is present.
Can you feel this? Can you move your foot?
No movement.
I'm going to go on the patient's left arm. Do I find a pulse?
Pulse is present.
Can you feel this? Can you move your arm?
No movement.
And then I'm going to go to the patient's right arm. Do I find a pulse?
Pulse is present.
Can you feel this? Can you move your arm?
No movement.
Okay. I'm now going to rotate the patient on their side so I can check their posterior side on the count of 3 by the head.
1, 2, 3.
I'm going to feel the back of the patient's head as well as neck just to check again for any decapitalis. Check the back and the patient's spine as well. I'm going to feel the posterior of the patient's buttocks as well as the back of the patient's legs one more time just to check. Do I find anything?
Nothing.
Okay, on the head, we're going to roll back down.
1, 2, 3.
I finished my assessment and found the rigid abdomen, which I will control as best as possible and continue to reassess my patient every 5 minutes due to the criticality while we are en route to the hospital and manage as necessary.
Okay.
Thank you for watching, and please follow up with your instructor or class coordinator if you have any questions.